Good afternoon. This is a presentation of the relationship between the United States military branches and mental health, researched and presented by Haven Watts. To adequately understand the information that we will be presented today, we will begin by learning the basics about the different branches that make up the U.S. military. We will begin by dealing with the four main branches. The Army, a land-based force focusing on frontline warfare. The Air Force, the branch that specializes in air power for aerial warfare. The Marine Corps, specialized in expeditionary warfare that has the important ability to deploy troops from the sea. And lastly, the Navy, specializing in naval and amphibious warfare. The pie chart to your right provides a visual for the makeup of the military by the amount of service members in each branch. Now we will address the common mental health issues experienced by the entirety of the U.S. military. These four mental health issues are presented in each of four branches. They consist of, but are not limited to, depression, anxiety disorders, post-traumatic stress disorder or PTSD, substance use disorders, and suicide. On this slide, we are interpreting the mental health issues by branch. In each branch, we have percentages of service members who experience depression, anxiety, PTSD, substance use disorder, and suicide. A few bars in our graph to note is the high rates of depression and substance use disorders in the Army, the highest rate of suicide in the Air Force, and the substantial rate of post-traumatic stress disorder or PTSD in the Marine Corps. I'm sure it was also easy to notice that the Navy has the least percentages in each category. Moving on to the preventions. The Army provides mental health screenings. The screening is done after graduation of basic military training and includes cognitive and temperament testing of trainees. They also document prior mental illnesses or issues. AIM in the Army is used to determine if recruits are well suited for military life based on things such as their temperament, ability to adapt, and motivation. Next, the Air Force has a behavior analysis service that is completed during the first 2 weeks of basic military training and assesses psychosocial history, performs psychological tests, and allows recruits to list their current symptoms on a checklist to be evaluated. The Marine Corps offers the Oscar program. This program is conducted after graduation of basic military training. The goal of this program is to learn how to manage stressors that usually have a negative impact on Marines' mental health while serving. Next, preventions is from the Navy. Peer mental health is integrated as soon as recruits arrive at basic military training. The Navy teaches each service member how to provide support to their peers as well as how to be proactive in situations where they need to activate a rapid response team. On this slide, we can see the interventions offered in each branch to service members who are experiencing mental health concerns. Each branch offers a substantial number of ways to get help, especially the Navy. The Navy has the most options for interventions. Moving on to our next slide, we are looking for consistent interventions that substantially decrease mental health issues in the military. However, as the graphic on your right states, there is not one size fits all for interventions. It depends on the individual and what works best for them. Therefore, there is no intervention that can be put in place to dissolve the mental health issues that military members face. Based on statistics, the branch with the least amount of mental health issues is the Navy, starting at the top. Following in line from the Navy, we have the Marine Corps, the Air Force, and then coming in last place for the most severe mental health among service members is the Army. In the military, there are two main barriers faced when seeking help for mental health. These barriers deter individuals from seeking the help that they need. The first barrier is stigma. Oftentimes, these options for seeking help are viewed more as a requirement that the military has to provide, rather than a non-judgmental option that is encouraged for members to use. The military is made up of 89% men. When faced with the already difficult stigma surrounding men's mental health, male service members often feel less masculine if they ask for help, especially in the generally masculine career of the military. The next barrier that is faced is permanent record documentation. Once a member seeks help for mental health, it is documented on their record and can constrict their job duties such as access to secret areas and weaponry. In some cases, service members choose not to seek help because they fear that they will be forced to medically separate from the military if their mental health issues are deemed too severe. The military has shared their aspirations to increase focus on proactive mental health initiatives. For example, suicide prevention programs, stress management training, and building resilience among those serving in the U.S. military. Thank you so much for allowing me the time to present to you today over the relationship between the United States military branches and mental health.